Hello, I'm Chris Ogden, consultant urologist at the Royal Marsden and Epsom District Hospital. So this is a urinary catheter. They come in various sizes, lengths, and made from different materials, but this is a fairly standard catheter which would be introduced into patients either urethral or from a suprapubic catheter into the bladder. And it's the long term, when the catheter is first introduced, it has obviously a clean surface and urine is sterile, and therefore it has no difficulty in draining. But over time, all foreign material eventually becomes encrusted, initially with biofilm and then the build-up of minerals to form encrustations on the catheter. These biofilms and incrustation are there needers for infection or bacterial colonization. And it's from this that patients then go on to have a urinary tract infection. It's also these biofilms or the build-up of these calcified deposits. They create a matrix where the bacteria are difficult to treat with the antibiotics because the antibiotics are unable to penetrate through the biofilm and the calcified matrix. The main complication from long-term indwelling catheter is recurrent urinary tract infection, usually treated by recurrent use of antibiotics. But long-term recurrent use of antibiotics leads to greater resistance and selecting out more resistant bacteria. So the sensitivity to these bacteria to common antibiotics becomes less and less. And that becomes a greater health problem in terms of treating patients with long-term indwelling catheters. We also manage it by flushing, and this involves the use of nurse specialists or doctors and attendants to hospital or from the community physician or nurses. And also regular changes of these catheters, which is uncomfortable and again necessitates more medical intervention and disruption to the individual's day-to-day life. So, in order to address the problem, it's a rather novel device which is very clever in the sense that it's simple in that it's an ultrasound device that creates vibration along the catheter, which is not felt by the patient. And this disrupts the build-up of the biofilm. By doing this, it reduces the opportunity and the needers for bacterial colonization and therefore the risk of urinary tract infection, but also enhances the ability of the antibiotics, if an infection does occur, to work more effectively. Hence a lower dose, and because infections are less frequent, less likely to develop antibiotic resistance over time by the constant use of different antibiotics. The device is very simple, both to apply and to use. It comes in a sterilized package and is connected to the battery pack, which in turn drives the device, which is placed over the catheter quite simply, and the power lead is then connected to the Uroshield power pack. And this can be discreetly placed anywhere on the body or in a pocket, and the device remains in place and is changed every 30 days. So the clinical application of the Uroshield has demonstrated much greater tolerance to the use of long-term indwelling catheters. In particular, reducing the infection rate, also the pain and discomfort from catheter blockage and bladder spasm. The data we have from the initial placebo-controlled trial in the States shows a demonstrable decrease from the placebo-applied device to the active device from 52% infection rate down to 4%, which is a significant reduction. There also appears to be a reduction in the catheter-related discomfort in terms of bladder spasm, which seems to be separate from the disruption of the biofilm, which reduces the urinary tract infection rate. This allows patients to tolerate their catheter for longer, reducing the necessity to change the catheter, which in itself can be uncomfortable and is disruptive in terms of having to either attend hospital or to be seen by the practice nurse. And the clinical use in patients that have started to use the device in the UK, the initial feedback is very exciting. We're delighted to see that at least 10 NHS trusts are now using the device, and the feedback so far is very positive. We continue to evaluate it and hope that it gives long-term benefit to a large group of patients that suffer unnecessarily from repeated urinary tract infection and catheter problems.